Hi. Okay. All right, here we go. All right. It's been another week of technical difficulties again, but it's okay. We got here. We got here. Yay. Happy Wednesday, guys. I hope you're having a fabulous day. I am Dr. Ravin Milton, and this is another episode of RX Info on the Go, where we give you information that you never knew you needed. So today we're going to be talking about selenium. It is an essential element that is in the body. It's actually on the um, periodic table. And for you, people out there who love chemistry and all, selenium is an essential trace element that is needed for the body. And we're going to talk about it just a little bit more in detail. So, do me a favor, like, tag, and share. If you could please like, tag, and share, I would appreciate it. And we're going to get this information out to you because it's another supplement that you may or may not need, just depending on you. Okay, so it's selenium is an essential trace mineral um, found in soil, water, and some food. Now, it's a cofactor for antioxidants. And what that simply means as a cofactor for antioxidants is that antioxidants cannot work without selenium present. It actually helps the antioxidants to be better. I guess is the best way to put that in layman terms. It helps it work better. Actually helps it work because without it, it won't work at all. So, um, selenium is something that is needed to help us fight off those UV rays, things like that, that are happening in our body to get rid of those oxidants that are breaking down things in our body that should not be broken down. So here we go. What is the major use of selenium? Well, top thing is going to be selenium deficiency because it is something that exists. Now, selenium is used to treat selenium deficiency as well as to prevent selenium deficiency. That makes sense, right? There are some other uses that are kind of thought of, tested in testing, but not necessarily a this will absolutely positively happen, but I'm going to list them for you anyway. So for autoimmune thyroiditis, try that again. Autoimmune thyroiditis. It is thought that selenium can help to improve the well being and mood due to the increase in selenium, which will help with the increase in thyroid activity. So that's one thing. Um, I don't know how to pronounce this properly, but I'm going to try it anyway. It's called Kashin, Kashin Beck disease. It's a rare disorder, and it seems that selenium will help with the symptoms of this disorder, but it does not. I'm sorry, it helps to prevent. I said that backwards. It helps to prevent this the symptoms, some of the symptoms with its disorder, but for people who currently have the disorder, it does not improve symptoms. So it helps to prevent, but does not improve currently. Now, that one was a little, odd for me. I've actually never heard about that particular disease state. So, if you want to learn more about it, you can look it up. Now, the last thing I have heard about is called preeclampsia. There is thought that selenium can help to prevent the risk, or reduce the risk of preeclampsia in pregnant women. Of course, we know that preeclampsia is when women have extremely high blood pressure. It actually causes some babies to be delivered early because it puts the mother at harm. So, selenium is one of those things that they're thinking may actually help to reduce that risk of preeclampsia. And those are like the uses of selenium for the major part. There are some other things that they are looking at out there, but it wasn't enough evidence to even mention it. So I was like, I don't want to get anyone's hopes up high, thinking that they can take selenium for, other things that it's just not going to work for. So the typical dose or recommended, I'll say the recommended daily allowance, because it is something that's in our food and in our diet. The recommended daily allowance is going to be 55 micrograms for adults, 60 micrograms for pregnant women, 70 micrograms for lactating women or breastfeeding women. Um, and that's pretty much the dosage that is recommended, the recommended daily allowance. Now, the typical dose when you are taking a supplement is going to be anywhere from 50 micrograms to 200 micrograms. We want to keep it within that level because actually overdose can be toxic. And anything that's over 400 micrograms is going to be not good for you. So you want to stay within the limits of 50 micrograms to 200 micrograms. And that's that on the dosing. Now, adverse effects. Selenium is typically well tolerated uh, unless you go into the overdose range. So your normal side effects, because like I said, and I say this all the time, anything that you take into the body, that you add into the body additionally, can have some type of an adverse effect. So when you do take these supplements of selenium, it is possible for you to have gastric discomfort or upset stomach. It's also possible for you to have headaches as well as a rash. Now, these are the minor adverse effects that will come with taking a supplement of selenium. However, there are some major side effects that can happen when you are overdosing, when you're taking too much. That can lead to alopecia, dermatitis, which is essentially a skin condition of rash, fatigue, which is being extremely tired to the point of not being able to, function where the way that you would normally function if you had the energy. Nail changes. The nail changes were not actually described on what type of nail changes, but I would imagine that your nails would either be brittle or, have some type of visible change that you could see. Nausea and vomiting, that goes along with the normal side effects of just having an upset stomach. Weight loss is another one, and um, these are all of the side effects that you might have if you are overdosing on selenium. Now, selenium is found in your multivitamins that contain minerals. So, if you are taking a multivitamin that comes with the mineral, something like, say, Centrum, because it's advertised from A to Z, or in their commercials, A to Zinc. Um, you may find selenium in that as well. If you want to make sure that your multivitamin has selenium in it, you can always just read your labels. It should include everything that is on in the multivitamin and what amount is in that multivitamin. Now, there can be some drug interactions with this particular supplement. The major thing is going to be anticoagulants and warfarin. It can increase the risk of bleeding when you are taking an additional supplement of selenium, and this would be in like a dosage over 50 micrograms and not just a small amount that's found in the multivitamins. So if you're taking like an additional selenium supplement, then it is possible that it can affect anticoagulants or warfarin. Another one is barbiturates. That's going to be your phenobarbital or things that are being taken for seizures. It could prolong the sedating effects. So selenium can make you sleep longer if you're taking something like um, phenobarb for seizures specifically is what most people will take phenobarb for. And when we say sleep longer, it's not just the sleep effect of the sedating effect. It can cause sleepiness, but it also slows down everything in the body. Whenever your doctor or your pharmacist talks to you about something being sedating, they're not just talking about something making you want to go to sleep, but it actually slows down the activity in the body. Um, of many of the things in your body, like your breathing, for instance. It slows down your breathing, it slows down your thought process, it slows down the activity of things in your body, not just making you go to sleep. So that's one thing to think about. And then immunosuppressants, it may reduce the effectiveness of your immunosuppressant therapy. So if you are someone who's taken an immunosuppressant for, say, a recent transplant, or you're taking an immunosuppressant for some type of autoimmune disease, just think about the fact that selenium may possibly decrease the effectiveness of that immunosuppressant. Um, Now, there are some interactions with other supplements as well. So selenium may reduce copper levels. That's one of the things that can happen. I had a talk on copper a while back. Also, zinc can reduce selenium absorption. So the combination of selenium and zinc can actually reduce the absorption of selenium. Um, And then there's omega 3, which can reduce selenium levels. So your uh, omega 3 fatty acids, or fish oil for that matter, can reduce the selenium levels. Just something to think about. Now, last but not least, overdose. It's really important to understand that some of these supplements can be overdose. Um, when you have overdose, or accidentally overdose with selenium, there are some symptoms that can occur, such as fever, nausea, vomiting, tremor, um, facial flushing, liver or kidney impairment, and respiratory distress. These are just some of the major things that would happen with an overdose of selenium. Um, if you have supplements around your house, it's just important to notice what those notice what you first have in your cabinet, and then notice or recognize some of the symptoms of overdose. Be knowledgeable of the symptoms of overdose, just in case something does happen accidentally and you have someone get into those supplements and they take more than what they should. Um, it's just I think it's important to be mindful of what's in your cabinet, and be mindful when children are around to make sure that they don't get into those supplements, um, because they can be harmful when overdosed. And that's, just wisdom, just using wisdom. So, um, I say this, I don't say it every episode, but I do say it quite often. Make sure that you check with your doctor before taking any type of over the counter supplement. It may interact with something that you're already taking, it may interact with your disease state. You want to make sure that your doctor is aware that you are taking any type of supplement. I do these things so that you can be knowledgeable of the things that are available to help you. However, I don't want them to harm you either. So please just be mindful. Talk to your doctors, talk to your pharmacist before starting any over the counter supplement. Um, and, make informed decisions about what you're putting into your body. That's going to be the end of this talk today. I thank you so much for sticking with me. It's very short and sweet, but I hope that you enjoy your beautiful day. I hope that you enjoy the rest of your lunch period if you are on lunch watching this. And I pray that you have an amazing day. Please do me a favor. I said it before, but I'll say it again. Like, tag, and share with someone who may need to know just about anything there is to know about pharmacy. You can also follow my YouTube channel, subscribe to it, please, please, please. You'll see all of the videos that I've done in the past. I've been doing this for a little over a year, just about a year and a half now. And I'm going to continue to give you information every week as I can. I thank you for sticking with me on those weeks that I'm not there, because, everybody needs a little bit of a break. But I thank you for still supporting. I thank you for still sharing. I thank you for subscribing to my YouTube channel and for following me on my Facebook page. If you get a chance, check out my website at www.drravinpharmd.com. I would appreciate any looks at the website and any purchases that you may make. I have merchandise there as well as books that are there, and some things are going to come down the pipeline. Thank you so much for tuning in, And don't forget to sign up on the website because I also have some emails coming through for the blogs that's going to be happening soon. I sent out my first blog and I'm going to catch up and get some more out to y'all. Thank you guys so much for your patience and thank you for your support. I appreciate it more than you know. Y'all have an amazing